All right, so now you've already watched the basic functions of the hearing aid. Now we're going to go over how to put them in. So remember, red goes in the right ear, blue goes in the left. So I still have the left one in my hands. I'm going to show you how to put it on. The back of your hearing aid, imagine that this is the back of your glasses or your sunglasses, right? So again, it's going to be the part right here that's going to go up over your ear. And when it sits on your ear, it's going to sit up at the top. So as I show you here, it sits right up here on the top, and it should be ready to go where I can put it in. So step number one is set it up at the top. Now when you go and you look at your instruction manual is going to say put it in your ear first and then flip it up over your ear. My patients have issues with that. It keeps coming out. So I found that the easiest way to do it is to put up over your ear first. And again, it's going to sit right there on the top. If you're pulling it back too far, then that speaker right here is not going to be ready to go in your ear. So every time you try to find it and put it in your ear, it's going to fall off your ear. Okay, so it's going to sit right here on the top. Okay, so step one, put it on the top. Step number two, you're going to grab the speaker and you're going to push that into your ear canal. Now again, it's not going to go all the way in because you have this little curly tail here that's kind of fighting against you. Okay, but you're going to put it in as far as you can go there. Step number two, after I put that in, we're going to go to three, which is grab the curly tail. And I like to grab it, put my thumb on the top, or my finger on the top, and with my thumb, grab it and curl it towards the back of my ear. So I'm going to grab it, curl it towards the back of my ear, and set it in the concha bowl just like that. Now you're going to notice right now, see the wire? See how it's sticking away from the side of my head? It's not in all the way. And that's where we come to step four. Step four, I'm going to push it into the ear canal the rest of the way. And if I don't put that little curly tail up, it's not going to let me do it because it's going to fight against it. Okay? So step number four is to push it in. We're going to put our fingers like we're shooting a gun. Okay? What it does, it allows our fingers to curve towards the back. So when I'm putting it in and I'm curving it towards the back, it helps it slip in. What happens is if I'm going like this, I'm going sideways, then I'm just pushing the hearing aid and it's going right into the side of my ear canal. It's not going the way it needs to go. Your ear canals actually, it's interesting because they kind of curl back towards the back. So if this is where the hole is and I'm going like this and pushing the hearing aid here, it's not going to make it. But if I have my finger pointed like a gun, I can go in and push the hearing aid into the hole. Okay? So again, like a gun, I'm gonna line up, and I'll show you closer up where I'm putting my finger, but I'm putting my finger right between where that curly tail meets up with the speaker, and I'm pushing it in towards the back. And it's gonna slip in, that wire is gonna be right up against the side. So see that wire is now right up against the side of my head, and now I'm good to go. If this ever got knocked off my ear, okay, it just hangs there. So one of the things to be aware of is if you're taking a sweater off or your shirt off, just like with glasses, it's going to take the glasses with it. So if you want to take your hearing aids out first, definitely can do that. If you don't, just be more aware, okay, I'm just making sure my hearing aids are still there and they're not like tucked away inside my sweater somewhere. So just kind of be aware of that. And that's really the 4 steps. So let me show you really quick to take it out, the wire right here. I'm going to grab that wire, I'm going to slowly wiggle it out of my ear, and then I'm going to go up over my ear. Okay? And what that does is it puts less strain on the wire. I had a patient in Chicago, he'd grab it from the back and kept yanking it out of his ear, and after 3 years of doing that, well, guess where all the force went? Right to here. So after 3 years, it snapped. He's the only patient I've seen where that's happened, where it snapped right there, and that's what he was doing. He was just yanking him out of his ear. So you want to grab the wire here on the side, come out, and then go up over your ear, and that's going to help. Now these hearing aids are really durable, so don't be afraid of them. Like I can bend the wire, I can drop it. Like of course, you want to take the best care because you've invested in your hearing that you can with these devices, but I don't want you to be afraid of them. So they are pretty durable. And again, remember, you still have your warranty and your loss and damage and all of that if something does happen, worst case scenario. But that's how you take them out. It's just right here on the side, which is going to be right up against the side of your head. Okay. If it's easier to grab the pull string, like the little retention cord, and pull it out of your ear, and then go up over, you can do that. If it's easier to pop the hearing aid up over your ear first and then grab it, whatever is going to be easiest for you. But that's how you take them out. When I show you, so like when it's in my ear, I'm bringing my finger, right, like a gun, and it's going right up here. I'm trying to put my finger now right in between that little retention cord and where the speaker is. And that helps me be able to maneuver it the right way to get it pushed into the back. So again, just remember, when you go and you put it in, step 1, up over the ear. Step 2, put this piece inside my ear canal. Okay. Step 3, curl that retention cord to the back. And step 4, finger like a gun. I'm going to push this in, and you'll feel it slide in, and it's going to be in where it needs to be. Okay? So if for some reason you're going like this, again, my finger is not like a gun. It's not up like this. It's sideways. Or if I'm pushing like this, I'm pushing towards my nose. Your ear canal is the other way. That's why I want you to have your fingers up like a gun to help push them in. Okay? So let me know if you have any questions with that. You should feel comfortable putting them in. Practice a little bit. If it's easier to have a mirror, you can do that. Sometimes some of my patients, it's hard because it's reverse and it makes them even more confused. Eventually you'll get to the point where you can just put them in, slide them in, like you'll get used to this. So that's how you put them in your ears and take them out. And then let me show you your case in the next video. So watch the charger case in your next video.